today we're presenting on asthma. My name is Lauren Cruz.
And I'm Marquita Davis.
I'm Bella Delgado.
And I'm Samantha Da Silva.
So what is asthma? Asthma is a chronic inflammatory disorder of the airways that results in recurrent episodes of airflow obstruction and is usually reversible. The clinical course of asthma is unpredictable, ranging from periods of adequate control to exacerbations with poor control of symptoms. Signs and symptoms of asthma include wheezing, dyspnea, chest tightness, cough, and all of these occur particularly at night or in the early morning. Expiration may be prolonged. An asthma attack may have an abrupt onset, but symptoms usually occur gradually. Attacks may last for a few minutes to several hours. Examination of the patient during an acute attack usually reveals signs of hypoxemia, and this includes symptoms such as fatigue, shortness of breath, and cyanosis. Epidemiology. Asthma affects an estimated 16 million adult Americans. Among adults, women are 66% more likely to have asthma than men. However, before puberty, boys are more affected than girls. The death rate from asthma is greater in women than men. Asthma has contributed to over 10 million lost workdays in adults. Annually, there are over 3,700 deaths of people older than 15 years of age, with more than 50% of these occurring in people older than 65 years of age. Older adults may be underdiagnosed with asthma due to the symptoms being similar to those of COPD. The significant morbidity rates related to asthma may be attributed to an increase in allergens in the environment, especially in the inner city. Asthma prevalence rates are over 38% higher among African Americans than whites. Female African Americans have the highest mortality rates from asthma among all ethnic and gender groups. Puerto Ricans have higher asthma prevalence rates and age-adjusted death rates than all other racial and ethnic subgroups.
What are the risk factors associated with asthma attacks? We have genetics, immune response. If a person is not exposed to certain infections early in life, uses few antibiotics, or they are not exposed to other children during childhood, they have a higher incidence of asthma. Exposure to common pathogens increases the immune system. Allergens such as animal dander, cockroaches, perfumes, mold, and pollen can also trigger asthma attack. Exercise-induced asthma occur after vigorous exercise, such as walking briskly and climbing stairs. Air pollutants, cigarettes or wood smoke, and elevated ozone levels contribute to asthma attacks. Occupational therapy, such as construction workers, agriculture workers, painters, and cleaning work are occupations with high risk. Also, we have respiratory infections. Bacterial or viral respiratory infections are often the major precipitating factors of acute asthma attack. And drugs, non-steroid anti-inflammatory drugs, and aspirin has been known to cause acute asthma attacks. How do we prevent asthma? Prevention of asthma attack includes patient education. We have to teach patient and family to identify and avoid known personal triggers for asthma. Prompt diagnosis and treatment of upper respiratory infections may prevent exacerbation of asthma. Good nutrition, hydration, and adequate rest also is good prevention measurements for asthma attacks. We should encourage patients to maintain a fluid intake of 2 to 3 liters per day. If exercise is planned, or if patient only has an asthma attack during exercise, talk to the healthcare provider to develop a pre-treatment plan. Vaccinations and medication also is used to prevent asthma attacks. Asthma is typically underdiagnosed because wheezing and coughing is also associated with other disorders, such as COPD, pulmonary embolism, vocal cord dysfunction, and heart failure. Diagnosis is based upon various symptoms and test results, which includes a detailed history and physical is important in determining if a person has had previous attacks of a similar nature, often precipitated by a known cause or trigger. Pulmonary function tests can also be used to determine the reversibility of bronchoconstriction and also establish the diagnosis of asthma. A spirometer is the preferred diagnostic test for asthma.
As far as treatment, prevention and long-term control are key in stopping asthma attacks before they start. Treatment usually involves learning to recognize your triggers and taking steps to avoid them, and tracking your breathing to make sure your daily asthma medications are keeping symptoms under control. In case of an asthma flare-up, you may need to use a quick relief inhaler such as albuterol. Preventive long-term control medications reduce inflammation in your airways that leads to symptoms. As far as medications, steroids and other anti-inflammatory drugs, particularly inhaled steroids, are the most important treatment for most people with asthma. These life-saving medications prevent asthma attacks and work by reducing swelling and mucus production in the airways. As a result, the airways are less sensitive and less likely to react to asthma triggers and cause asthma symptoms. Bronchodilators and asthma. Bronchodilators relieve the symptoms of asthma by relaxing the muscles that can tighten around the airway. This helps to open up the airways. Asthma inhalers. Asthma inhalers are the most important and effective way to deliver asthma drugs to the lungs. Asthma nebulizers. If you're having difficulty using small inhalers, your doctor may prescribe an asthma nebulizer, also known as a breathing machine. The asthma nebulizer uses a mouthpiece or mask and is typically used for infants, small children, older adults, or anyone who has difficulty using inhalers or spacers. As far as dimensions of health, and during your daily life, you will have to avoid triggers and keep up with your breathing patterns. Sleeping, asthma symptoms are often worse at night. This means that you might wake up in the middle of the night coughing with a tight chest. Exercise. If you have asthma symptoms during or after exercise, you'd have to speak with your doctor. It is likely they will review your general symptoms and personal asthma plan to make sure your asthma is under control. Some of the tips when exercising is to use a reliever inhaler, usually 10 to 15 minutes before you exercise, and again after 2 hours of prolonged exercise or when you finish. Structure your exercise plan around short burst activities and ensure to warm up properly. Exercise in a humid environment such as a swimming pool. Breathe through your nose to avoid hyperventilation. As far as diet, most people with asthma can eat a normal healthy diet. Occasionally, people with asthma may have food-based allergic triggers and will need to avoid these foods, such as cow's milk, eggs, fish, shellfish, yeast products, nuts, and some food colorings and preservatives. However, this is rare.
Spiritual and emotional support. Asthma can be challenging and stressful. You may sometimes become frustrated, angry, or depressed because you need to cut back on your usual activities to avoid environmental triggers. There is Asthma and Allergy Foundation Association, known as AAFA, which provides educational support groups for parents, preteens and teens, and all adult groups. It also provides online resources like brochures, pamphlets, fact sheets, and activity books that help other people understand the disease process. American Lung Association, known as ALA, provides self-management classes for adults and can help you find local support groups. The Lung Line is a free information service for healthcare consumers provided by the National Jewish Health. You can ask a specialized nurse questions about early detection, care, and prevention of asthma attacks. It also provides with up-to-date information and free educational materials. Rehabilitation goal and services is to decrease asthma morbidity and mortality rates and improve the management of asthma worldwide. Goal of asthma is to achieve and maintain control of the disease in order to return the patient to his or her daily functioning at the best possible level and to prevent asthma attacks. To maximize the ability of the patient to safely manage acute asthma exacerbations via an asthma plan. An asthma action plan is a written customized guide to taking medications properly, avoiding factors that can cause a flare-up, and treating other conditions that can interfere with asthma control. This can be made together with the patient and the healthcare provider based on the patient's asthma symptoms and peak expiratory flow rate, which must be measured daily by the patient. During an acute attack, the goal is to decrease the patient's sense of panic. So you must do this by providing a calm, quiet, reassuring attitude, positioning the patient comfortably, usually sitting, to maximize chest expansion, staying with the patient and providing additional comfort, talking down by maintaining eye contact, a firm, calm voice, coaching the patient to use pursed lip breathing technique, which keeps their airways open by maintaining positive pressure in breathing, which slows the respiratory rate and encourages deeper breaths. These are references, and this concludes our presentation. Thank you for listening.